This is Dr. Deuk at Deuk Spine Institute, Surgery Center, Vieira, and we are, joking, dude. You come over here. Luis, over here, please. I mean, I've already done that. I need the stylet. It is August 25th, 2022, and we're performing a Deuk laser disc repair spine surgery. This is for two herniated discs, L4-5 and L5-S1. And our patient has back pain and intermittent left leg symptoms. Now, he doesn't have a lot of sciatic pain right now, but he did when his back started hurting, and it was down the left leg. It has gotten better with the sciatic symptoms, but he's had chronic back pain at the L4-5, L5-S1 region. Can you guys see the field here? No, I'm not going to do anything. Just can you see the field here, Henry?
Yep, you see it.
So his pain is in this area right here, like pretty much everybody's pain. And what's in this area right here that could cause pain? The skin doesn't cause pain. The muscles never cause pain unless there's something causing them to be irritated. So what causes pain in this area is typically a joint problem. And there's two types of joints in the spine. There's the facet joints and there's the disc. And we believe his pain is coming from his discs, the L4-5 and L5-S1. That's based on just probability plus the MRI findings of two herniated discs right in that area. Remember, let me know if it's uncomfortable, okay? I'm giving the numbing medicine some time to work. Shot? So to get to the discs that are painful, I have to navigate. And navigation means I use something as a reference, and that something is the X-ray machine. So AP. So we're going to use two views, a side view, lateral, which is what you've been looking at. And now we're going to an AP view, which is a front-back view. Of the two discs we're treating, the bottom one is the most preserved. It's a more recent type herniation. The upper one, the L4-5, is been injured for quite some time. If I had to guess, based on the MRI appearance, the L4-5 was injured probably several years ago when he started having problems. Shot? And the L5-S1 is a more recent injury. Shot? So there, shot? All right, that feels pretty good. Let's get an AP. I think I'm on the facet. That's where I want to be. I'm going for the L5-S1 disc first. And what I was trying to say is we use this X-ray machine to do the navigation. Shot? Yeah, it's perfect. Navigation means that you're going somewhere with something, physical object. Either you're navigating yourself or you're navigating an object somewhere that you want it to go in a three-dimensional space, usually in the real world. And we're navigating to the L5-S1 disc. Shot? That's what we're navigating to. Okay? Shot? Yeah. Perfect. Are you comfy? All right. I apologize that you have to be awake for this part, but it is necessary. Shot? All right. Shot? Try not to get my hand at this point. Shot? I have to keep my hand there. There you go. Let's get an AP view. Do you feel anything? All right, so our patient needs to be awake for the first 10 minutes while I get into the discs with the spinal needle. Great. Shot? Perfect. It looks really good. That's really nice placement of the needle at 5-1 because it's a shallow herniation. It's not a big. It's more of what we call a disc bulge, which is a small herniation. and it's running along the back wall, and that's where we are. Okay? Are you comfy? All right. Let's give a little more. What is it? You want pizza, huh? All right. What kind of pizza do you like? What do you say? Oh, meatball pizza. Meatball by itself or meatball and ricotta? With ricotta, there you go. See how I knew that? You know what my favorite pizza is? No. Well, that's what I eat here. But if you want to know my favorite pizza, it's meatball, ricotta, and sun-dried tomatoes. Nothing better. Nothing better. You can't get it here. You can't get it here. No, you got to go. No, I haven't had it in years. I used to get it in San Diego when I was at UC San Diego for undergrad. Huh? What do you say? Yeah, Anthony's, right. We do have an Anthony's. I don't think they have sun-dried tomatoes, though, because I've asked. You can add them? All right. I'll try it next time. We have an Anthony's near my house in Orlando. So also I got it at UF in Gainesville. When I was a neurosurgery resident at UF, they had a place called Leonardo's Pizza by the Slice. Famous. Leonardo's. Shot? And it was, that's where I ate pretty much every day when I was a resident. Shot? Because the alternative was to eat at the hospital, and they had, the cafeteria food, which was horrible. Shot? Shot? So whenever I could get out, shot. And remember, I used to work 110 hours a week on average. I mean, not on average, pretty much every week. Some weeks I worked 120 straight in the hospital working. No sleeping, just working. All right. But sometimes I had a little break and I could get a slice of pizza from Leonardo's. Kept me going. It's the little things in life that count. When all you're doing is working 110, 120 hours a week straight at the hospital, a slice of pizza can make all the difference between sanity and falling off the edge. Right? All right, so you're doing great. We're almost done, and I'm going to put you to sleep soon. We're just so close, all right? Hang in there. I apologize that you have to be awake. The good news is we're almost done. All right. So at this point, I want to show you what we've done. You can turn the lights down. Whatever you got to do. And then can you see this over here, Henry?
Yep.
All right. You lay still, okay? We're almost done. I'm going to put you to sleep in about 5 minutes. We've got both spinal needles in. It's a 7mm cut. The entire surgery is done through a 7mm cut. We're going to fix 2 herniated discs. The bottom one is the L5-S1. If you look at the MRI, there's a tear here, and the jelly from the center has pushed through the tear, and it's stuck in there, and that's what's causing his back pain. Then at the L4-5, it's a bit more advanced. This tear has been there longer, probably 3 years. The disc is now collapsed, and it's turning dark, and there's definitely a bigger herniation here, okay? So we've got L5-S1 disc, and we've got L4-5 disc. Now, I believe these 2 discs are the cause of his back pain that he's had for the last 3 years. Are you comfy? Have you watched any of my surgeries? Okay. All right. Not any pain right now? How bad is that on a scale of 1 to 10? What's the highest it goes? Give me a number. 7. Tough guy. All right. Is that where you typically get your pain? Yep. All right. So L5-S1 was a 7/10. That was your L5-S1, by the way. You okay? Don't tell him what I'm going to do. He's not supposed to know. Is he uncomfortable? Seems like it's a bit higher than a 7. But you don't have to be a tough guy. Persian 7. Oh my God, I love that. Put that Persian 7 out of 10. That's right. You guys fought along with war elephants. I mean, right? Of course. There weren't 1,000 Persians against 300 Greeks. It's bullshit. That's just what was written in history, right? It's sensationalized. I think I know what really happened. We'll talk about it later. I think the Persia got rid of their criminals out of the jails and just sent them over to go over there. Kill two birds with one stone, right? All right, you comfy? How bad is that on a scale of 1 to 10? All right. Is that a Persian 10 or a... All right, 11 over 10. 11 over 10. A Persian 11 over 10. Is that where you typically get your back pain? All right, so that's concordant. All right, you get to go to sleep. When you wake up, we'll be done with your surgery and that pain will be gone. It won't come back. We just confirmed that your pain is coming from those two discs. All right, for those of you watching, what we've just done is what's called a discogram. And a discogram is a procedure whereby we inject some dye into the disc. The dye itself doesn't do anything except let us see on the x-ray where it is. Jordan, why don't you show the audience on the x-ray. Go back to the lateral x-ray, Henry. Show them where the tear is in the back of the disc at L4-5, yes, and L5-S1. Yep, there you go. So you can see the tears look different, don't they? The 5-1 tear is a little bit, the 5-1 tear is a little higher up, and it's almost split in two. There's a bottom part, and there's a top part. So it's a double tear, and then the L4-5 is just one giant tear, kind of in the middle of the disc, in the annulus. So that tear is exactly where the pain's coming from. And that was discovered by me, the founder of Deuk Spine Institute. And because I found out where the back pain comes from the tear, in the back of the disc, I'm able to go in and fix it. How are we doing, doctor? So we're going to go in endoscopically, see the tear, and we're going to repair it with a laser. And it is the annular debridement that cures the back pain. Specifically, annular debridement that cures the back pain and the leg symptoms. And that's what we're going to be doing today. All right. Good, shot? So is that 5-1, Luis? Yeah, shot. All right, there's the guide wire, shot. I want to make sure it's in far enough, and it is. And now we're going to take the needle out. We've already made the incision. So let's show our audience, Henry, why people have back pain from an annular tear in the back of their disc, and what causes it. You'll see it's all due to inflammation, as the disc tries to heal itself, but it's unable to do so.
Traumatic injury to the disc can cause annular tears to form. Pressure on the disc causes herniation of the nucleus pulpus through the annular tear. Inflammatory tissues develop within the annular tear, causing back pain. The inflamed annular tear generates pain signals. Additional injuries can cause symptoms to worsen. Inflammation from the annular tear can spread to nearby nerve roots, causing leg pain. Signals travel up nerves to the brain, causing localized back pain. Pain signals reach the primary somatosensory cortex, causing conscious awareness of pain. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
All right, folks, welcome back. Now you've seen that the tear in the back of the disc is the cause of back pain due to inflammation. We're going to go in there and clean out that tear, remove the herniation that is stuck inside the tear. It's called the interposed herniation. It's different than what other surgeons remove. They remove the herniation outside the disc only. We remove the herniation outside the disc and the herniation within the tear, both. And that's why we fix leg pain and back pain. So, folks, the whole surgery, can you see this? It's going to be done through this tube.
Yep. We see it.
Perfect, yeah. It's literally like a straw, but it's not a straw. It's a very expensive straw if you use it as a straw. And we're going to slide this down over the dilator, right into the tear and right into the herniation. You're okay? Shot? Dr. Berndes, all I can say is I hope you don't need any work done on your teeth anytime soon. All right, we'll just wait a minute. We'll give you a little more num-num, see if that helps. So we're actually going to put a little bit of numbing medicine inside the disc, and that's where the dilator is. That might actually give him some more relief. Not easy to get any out. But at this point, we're basically sliding the dilator down, sliding the tube down the dilator. We're going to need more of these at some point because they're flaring out at the end. Let me know when I can proceed. Yes? Looks good. Shot? All right. Keep an eye on the dilator, Luis, with me. Shot? Shot? All right, so you can see the dilator came back just a little bit. Shot? But our tube is now inside the disc, inside the tear. Shot? That's perfect. All right. Good. Let's get rid of the fluoro. So we're going to fix the L5-S1 herniation first. The more painful of the two was the L4-5 in his case. The number one disc in the lower back to be the source of pain for patients is L4-5. The second most common is L5-S1.
Endo in the sky, please.
All right, we're ready to bring the rig in. Now I want to show you guys the rig. Can you guys see this, Henry?
Yep.
So this is the camera. It's a high definition camera. We have a light source right here, which, can you see that?
Yep.
Provides very high intense light. And that transmits through the end of the scope, through little fibers that project light down here so I can see what's going on. The camera takes the image from the rod lens system of the scope, brings it to a monitor, and then we have irrigation here. All right? It's nice cold saline irrigation. That keeps flushing all the debris out and the blood out if there's any bleeding. Now the bleeding on these surgeries is virtually nothing. It's literally a few drops. So it's pretty much bloodless surgery. And it's outpatient surgery. This patient's going to go home an hour after surgery. All right, there's some of the herniation. Since we're right inside the tear, we actually shoved the herniation from outside the disc back into the disc. So it's the only surgery, this endoscopic surgery is the only surgery that does that. And the technique is called the inside-out technique. It was taught to me by Dr. Anthony Young, who's a pioneer in endoscopic surgery, one of the greatest teachers in my career. And he taught me a lot about endoscopic surgery on the lower back. Now, I had to pioneer cervical and thoracic endoscopic surgery because Dr. Young never did cervical or thoracic. He only did lumbar. But I didn't want to limit myself to just fixing people's backs because I knew the same problem exists in the neck and the thoracic spine. It's the same issues. It's a disc problem. All these discs are basically the same structure. They're just different in size. But they have an annulus fibrosus and a nucleus pulposus, and they're innervated with somatic afferent fibers, which are pain fibers, in the back wall, which is why people have so much pain. Again, I've tried teaching this to other surgeons around the world, and many of them are starting to listen and understand the truth. But many of them don't want to hear it, and many of them still are ignorant. They want to remain in living for some reason in ignorance. Our treatment has been peer-reviewed and published in the medical literature multiple times, and it's been peer-reviewed by neurosurgeons, and it's considered safe and effective for the treatment of symptomatic disc. All the equipment we use is FDA approved. We don't use anything that isn't FDA approved. The laser is FDA approved for medical use. The fiber is FDA approved. All of our instruments, medications, equipment, whatever needs to be FDA approved has been FDA approved. So, if you're wondering, let's go ahead and show our audience how the Deuk laser disc repair actually works. What does it do? How does it do it? Why does it work?
Disc herniations are a common cause of chronic back pain. The inflamed annular tear causes back pain. Inflammation of the nerve roots causes leg pain. A Band-Aid-sized skin incision is made. A small tube is inserted without damaging the bone or soft tissues. The laser removes the herniation and debrides the annular tear. The annular tear heals on its own. If you have a herniated or bulging disc and back pain, submit your MRI for a free review at www.mri.deukspine.com.
All right, folks, well, now you've seen why the Deuk laser disc repair works to fix back and neck pain from a herniated disc. Now remember, not all back and neck pain come from a herniated disc. Most of it does, about 80%. Those are unpublished numbers that we haven't published, but we do need to publish them. And the other 15% comes from the facet joints. That's F-A-C-E-T. Can you type that in the dialog box? So disc herniations, 80% of back pain, facet joint, 15%. And then after that, it's other causes like SI, sacroiliitis, piriformis syndrome, coccygeal ligament inflammation, and fractures, which are easy to see, by the way. You can easily see a fracture when it's there. So right now, the blue stuff is the tear and the herniation stuck inside the tear that you saw in the video. All right, we stained it blue. This dye we use specifically stains the interposed herniation of the nucleus. You can see the tear right there to right there, and all this is now being scarred. It's scarred in there. All the blue stuff is usually loose. When it originally popped out and the tear happened and the blue stuff came out, it created inflammation, and that inflammation over time created scar tissue. And the scar tissue has scarred the blue stuff down. That's why it just won't come out. It just doesn't like slide out. You have to actually burn it out with a laser because it's really stuck down to the tear. So we call it a debridement of the tear. It's the most appropriate terminology. We literally are debriding, surgically debriding the annular tear. And Deuk Spine and myself, we're the first ones to publish this around 10 years ago in 2012 in Surgical Neurology International, the debridement of the annular tear. It's revolutionary. The problem is that unfortunately most surgeons, they don't have the equipment, they don't have the training or technology, so they just continue to do old barbaric surgeries like fusions. And a fusion, you're basically taking the disc out completely, which you don't need to. You just need to clean out this tear, and then you're done the job, and the patient will be out of pain from the disc. I'm going to show you the tear right here again. See that tear right there? The blue stuff is stuck inside the tear. The tear goes left to right. And the blue stuff came from the center of the disc, and it's literally scar. This is scar tissue. All this little white things you're seeing with the laser, that's calcium, the gold stuff, and the white stuff is scar tissue. Again, we are the pioneers of this technology at Deuk Spine Institute, and can't find this anywhere else in the world. Now you can find endoscopic surgery, you can find discectomies, but an annular debridement, we pioneered it, and it is the standard of treatment, standard of care for treating back pain from a herniated disc. All right, any questions from the audience?
No current questions.
Let's show our audience what happens if they don't come to Deuk Spine, they end up getting a fusion to treat their back. Let's do a comparison side by side. Fusion of the spine and the lower back versus laser.
Deuk laser disc repair, a comparison with traditional spinal fusion surgery. A patient with chronic back or neck pain originating from a symptomatic disc injury could undergo either traditional spinal fusion or less invasive Deuk laser disc repair. This MRI represents a typical case with L4-5 and L5-S1 symptomatic discs. A symptomatic disc causing neck or back pain can include bulging discs, herniated discs, ruptured discs, degenerative discs, protruding discs, spinal stenosis, radiculopathy, and sciatica. This patient can choose traditional fusion surgery or the Deuk laser disc repair to help alleviate the pain caused by and within the symptomatic discs. Here, two patients with comparable disc injuries are treated. On the left, the highly invasive spinal fusion, and on the right, the least invasive Deuk laser disc repair. The spinal fusion requires a very large incision, usually leaving a large scar. The Deuk laser disc repair requires only a very small incision, usually less than a ½ inch long. In this small opening, a cylindrical rod, called a dilator, is inserted to gently spread the muscle to create a small passage and guide through which the surgery is performed endoscopically. The incision for the fusion continues, including penetrating the skin, fat tissue, and multiple layers of muscle through to the bone. With the Deuk laser disc repair, a mallet is used to advance the tip of the dilator into the symptomatic disc. A tube, called the tubular retractor, slides over the dilator and is carefully positioned into the disc, again using the mallet. The rest of the entire Deuk laser disc repair surgery will occur inside this narrow tube. To access the spine, the spinal fusion requires the muscle to be separated from the vertebrae. This very invasive action causes trauma and permanent damage to the muscles. Whereas in the endoscopic Deuk laser disc repair, the muscle is not damaged. The endoscope camera is inserted into the tubular retractor to allow the surgeon to guide the laser inside each symptomatic disc. To accommodate the fusion hardware, a large bone grabber is used to perform a laminectomy by removing bone from the spine. The fiber optic laser used in the Deuk laser disc repair is manipulated with great accuracy to remove only painful inflammatory tissue from the disc. In this highly magnified view, the laser is used to precisely remove damaged disc material that is causing the pain. The laser is debriding, or essentially vaporizing, damaged tissue in the disc's outer layer, or annulus, specifically at the annular tear, the source of the rupture or herniation and pain. After the fusion patient's damaged discs are removed, a metal or plastic cage housing bone grafting material is inserted in place of the removed discs. Once the laser has removed the painful part of the annular tear, the endoscope and tubular retractor are removed, leaving less than 1/2 inch incision in the skin, which is closed with a single stitch, Steri-strips, and a Band-Aid. Total time for the Deuk laser disc repair surgery, approximately 1 hour. The fusion, however, is still underway. Holes in the spine must be tapped in preparation for the large pedicle screws that anchor the fusion hardware. The Deuk laser disc repair patient is in recovery usually 45 to 60 minutes before released to go home. The fusion screws are inserted into the bone, as shown in the X-ray. After all screws are in place, rods are used to connect the screws together to prevent movement of the
Out of the comparison video, but I thought it was important to show you. We're at L5-S1. We're inside the tear. We're getting to the periphery of the tear now. And I want to show you this pink stuff. You see that pink material right there? That may be hard for some of you to see. That pink material there and over there, this is all inflammation, inflammatory tissues that's painful. This is where those painful nerve fibers come from after the tear happens. So you get a tear in the annulus, and then the jelly comes through, the blue stuff, and that creates inflammation. And these little areas, these little nests of pink tissue, are where all the pain fibers are for the nerves. That's what causes all the pain. So we want to make sure we get them. And they're naturally pink. We don't stain them pink. They're pink because they have blood flow in them. You know, red blood cells are red. So it's really a reddish color. But with all the tissue around, like the wall of the blood vessel, it looks pink. Point is, that's where the inflammation is going on within the annular tear. And I wanted to show you that. Just about done. You see there's still more tear right here. There's normal annulus up there, and there's tear right here. Just so you can see the difference. Ooh, who's rubbing my ankles? Honestly, I felt like I was back home for a minute. Because, you know, seriously, as soon as I get home, my dogs, they're little hot dogs, sausage dogs, little Doshkins. They literally, I'll be standing there in the kitchen, and I'll start to feel my ankles rubbed, and it's their noses nudging me because they want treats. They want, like, you know, pieces of cheese, basically, from the refrigerator. And they're always just nudging me for something to eat. My wife, they don't nudge her, they just look at her and stare at her with those eyes. And she has to give in. She just gives them treats galore. So I was supposed to be in Valencia, Spain today with my son, who's testing in a race car with Van Amersfoort Racing. But this patient and the other one had procedures scheduled, and we don't want to make them wait. So my wife said, I'll go to Spain and keep an eye on the kid. You go to work. So here I am. I've never been to Valencia, no. But I got some videos of him on the racetrack with his European Formula opening car, EFO. You're not allowed to, he's going to be racing FIA F3 next year, which will be televised in Europe. You're not allowed to practice in the F3 car. The FIA does not allow it. You literally are not allowed. They regulate the engine use. It's all computerized. They can tell if you've been testing in the car when you're not supposed to. The team will get sanctioned. So instead of testing in the FIA F3 car, you have to test in a European Formula Open car, which is what he's doing. All right, you can see that's the end of the tear. Look at that fat up there. Those are fat cells. Each one of those little sparkly things is a cell. And it's holding lipids. You can see the lipid kind of oil ooze out of it there. If you rewind, you'll see it. But that's epidural fat. And the reason why there's so much fat around here is why? Anybody know? Let's see if our audience knows. I'll give it a few minutes and then I'll tell you why. Just think about fat's purpose. Fat has a couple of purposes. And why would there be fat in this area? All right, just about done here at L5-S1. Remember, L5-S1 was the better of the two discs. The L4-5 definitely is worse. This is all herniation right here, the blue stuff. That's why I'm vaporizing it. The laser just charges it full of energy and it breaks it up. You can't even see it, but if you could slow down the camera, you would see it blast apart into little pieces. And then all the pieces just come out, you know? They just come out through the tube that I have in here. Because what you're not seeing, it's invisible to your eyes, is the irrigation, the movement of fluid, cold fluid through here. Just about done. Now the white stuff is normal disc. That's normal nucleus pulposus. The blue stuff is the degenerated disc. All right, just about done. 10 seconds. 5. We've cleaned the tear up. And what I'm seeing there are fibers from what's called the posterior longitudinal ligament, or PLL, behind the disc. And that looks good. I don't see anything else. Did we get any answers on what's the purpose of fat being here?
No, but we do have 2 questions.
All right, well, the purpose of the fat being here is, number one, to provide energy for the nerve root, which is right there under the fat. I'm going to do one more little zap right here. And the second purpose of fat being around the nerve root is to cushion it, okay? You can actually see the individual fat cells right there. Each one of those little balls, those glistening golden balls, is a fat cell. Cool, huh? And let's see. You can actually see capillaries. Those are capillaries right there. Those little, like wisps. Those little wisps are basically capillaries and little venules leaving capillary beds. Okay? Pretty cool. Pretty damn cool. All right.
Lights on, please.
We'll take your questions as we finish up the L5-S1.
The first question comes from, all of this comes from Rigaleb on YouTube.
Go up, please.
Sure.
And they asked, the first question is, have you ever had pro athletes operated which returned to their activity after the laser repair?
Have I ever had pro athletes operate on the return to their sport? I guess you're asking about their sport. When you say activity, I imagine you mean their sport. Yes, absolutely we have. Nobody like super famous like Michael Jordan or Kobe Bryant or anybody like that, or Tiger Woods, but we have had pro athletes, hockey players, basketball players, wrestlers, rugby players, horseback riding. Those are the ones that come to mind. I can't give you their names, but I can tell you that we have. This is the perfect surgery for a pro athlete, by the way. Okay, there's tons of athletes that are sidelined from spine injuries, back pain, neck pain, and this is the perfect surgery because there's no fusion, no metal, no cadaver bone being put in. There's nothing being put into the spine. We're just repairing the tear with a laser, and then the disc will heal, and then they can do whatever they want. They can go back to playing sports. Now, I wouldn't let a pro athlete go back to their high level of playing a sport until the disc is healed, and it will take time to heal. But once it's healed, then they can go back to full activities without restrictions, and the disc will be strong and solidly healed. But they need to wait. They need to wait usually a full year, sorry. I know it sucks, but it's better than being sidelined the rest of your career or having chronic pain that keeps coming back. But the disc heals very slowly, and I would say in most cases it'll take a year before they go back to their professional endeavors. Now, other activities they can get back to sooner, like hobbies, activities of daily living, like bathing, eating, doing normal stuff, driving, shopping. Those things they can go back to much sooner, but the sport that they're playing, they should lay off for a year if they want things to heal properly. And at the end of the year, their disc will be almost like new. All right, shot. We're going to start on L4-5 next. That was the more painful disc, if you remember. That's the one where he had 11 out of 10 pain, and that was 11 Persian 11, a Persian 11. If you couldn't tell, our patient is Persian. He's very proud of being Persian. I was looking at his tattoos. I can't give you anything identifying about him, but shot, I can tell you that he did leave. He has a lot of I have to be careful what I say here, so I'm not going to say it. But let's just say there's room for a tattoo of me on his arm. He said if I fix his back, he might put a tattoo of my face on his arm. I thought that was pretty funny. All right. We are now at L4-5. We're sitting with the dilator, as you can see, show the audience on the x-ray where the tip of the dilator is. Look at the white arrow. You can see the tip of the dilator. We're going to advance that along the guide wire. Show them the guide wire. Yes, perfect. You can actually see the guide wire going into the dilator and then up the center of the dilator right there. Yep, that's it. So we use the guide wire to navigate the dilator. And remember, we placed the guide wire through the needle that we had put in there originally. That's how it's done. Shot? Now, I didn't come up with the dilator and the guide wire. That's all developed by much smarter people than me. But the annular debridement part, that's what I came up with. And that's, in my opinion, the most important discovery for curing back pain and neck pain. All right, what other questions do we have from our audience?
Next question comes from Rigaleb once more. And they asked, when pain is associated with facet joints pain, can PRP help with those extra inflammations?
Yeah, great question. So one of our astute members watching our surgery live has asked, if a patient does have facet joint pain, can PRP help? And the answer is yes, absolutely. PRP is great for facet joints if you want to try it. And it certainly can help with the inflammation. We've done it before here at Deuk Spine. We do PRP and stem cell. Dr. Patel does it. And we've had good results with the facet joints. That said, you want to make sure it's the facet joints before you start messing with them. And the way you do that is with a diagnostic medial branch block, a diagnostic MBB. But yeah, PRP and stem cells can definitely be useful. Now, if that doesn't work, we do have another treatment here at Deuk Spine.
Yeah.
Go ahead. Yeah, we have another treatment here at Deuk Spine called Deuk plasma rhizotomy. And we developed it here. Shot? Perfect. Deuk plasma rhizotomy, folks, is where I go in and use a special wand that delivers plasma to the pain nerve sitting on that facet joint, causing all that pain. And it's better than an RFA because RFAs wear off after 6 months or less. And people are back having another RFA done because the pain comes back. Because the reason why is the RFA doesn't really deaden the nerve properly. But the plasma we use does. We've now done about 10 patients with the plasma rhizotomy. And they've all of them have their facet pain gone and permanently gone. But it's only been about 6 months. So we don't have really long-term outcome data yet.
Thank you. And Lisa. Thank you.
All right. Well, here we are at L4-5. I told you it's a more degenerated disc. That's fine. We're still going to repair it. The tear is worse. You got a little more bleeding. Let me have the grabber. Because there's more inflammation. Remember, inflammation is where your body grows blood vessels and nerves and scar tissue in an area where it's trying to fight something off. It's like a war zone, right? And so your blood vessels are basically a transportation system in your body that brings assets to the inflammation zone. So think of them as bridges, rivers, basically roads, ways for your body's inflammatory cells, like your macrophage, polymorphonucleocytes, we're called PMNs, aka neutrophils, eosinophils, and fibroblasts and little endothelial cells that make blood vessels. So all these inflammatory cells get to the area of inflammation by the blood system. We call it the vascular system, blood vessels. That's their road. Okay? So it's like a war zone. And the supplies of food, artillery, weapons, troops, all of it travels along the blood vessels to the area of inflammation. And so that area of inflammation in your body has very well developed network of blood vessels over time, years, because of the inflammation. And so it's going to be more vascular. We call it more vascular, meaning more bleeding and more blood vessels in the area. Because the longer the inflammation goes on, the more those roots are developed by your body. So, you know, for example, if you're fighting a war, say in Ukraine, or better yet, if you were fighting a war in Russia, and you were Ukraine invading Russia, let's just say, the Ukrainians would be widening the road so their tanks and their transport vehicles can get to the areas of conflict easier with bringing supplies there. So the body is not so different than a war. And this area of inflammation has high vascularity so that it can bring supplies like cells, glucose, take away debris, you know, carry away things that are a result of the inflammation going on. Yeah. In war, those things would be, unfortunately, dead soldiers that leave the battlefield via those transports, or people going and relocating. So inflammation in the body, like going on in the back of the disc, is very similar to war. It's destructive. It hurts the body. It tries to hurt the invader, which in this case is the herniation. And there have been studies that have shown that nucleus pulposus, the stuff in the middle of the disc, is highly inflammatory. We didn't do those studies at Deuk Spine, but that's well known, well published. What it means, folks, is the nucleus material from the center of the disc is walled off for a reason. God walled it off so that it's like a criminal. It's a very violent, nasty, mean, antisocial creature that sits in the middle of the disc, walled off by the annulus. And it's like Hannibal Lecter. It's so dangerous and damaging that even the inside of the disc doesn't have blood vessels, because it's so inflammatory that the body has to hide blood vessels from it, because it will create inflammation. And when you get an annular tear, you're opening the gel cell, you're letting the criminal out. And as soon as he sticks his head out, he starts creating inflammation and pain. And that's exactly what the nucleus does. And that's what we fix. We basically remove the criminal. We put Hannibal Lecter back in his cell. All right, now some of you may be too young to know who Hannibal Lecter is, but I assure you he's worth studying. One of the best series of movies ever made was the ones with Hannibal Lecter years ago. I watched them as a kid, and it's unfortunate because movies these days are so bad. They don't really teach you anything. They just how bad movies can be made. That's my opinion. I'm not one of these woke people. I'm sorry. But for me, movies should be educational and entertaining and have some basis in reality in life. You know? Even Star Wars, to me, the greatest movie ever made. Star Wars and Return of the Jedi and Empire Strikes Back. Those three movies, they're as fantastical as you can imagine, but they teach us about humanity and human nature and the resilience of human beings, the resilience of good against evil. They provide us great lessons in life to give us hope and give us purpose. You can't say the same thing about Baywatch. All right? Sure, the chicks are hot, but, you know, and so is David Hasselhoff. But, you know, even David Hasselhoff in Knight Rider, he did a great job, if you know what I'm talking about. The old Knight Rider series, you know, fighting evil. Life is really about a struggle between life and death, good and evil. And I think sometimes you need a distraction from that, but For the most part, the best lessons are learned from books or movies, teachings of that philosophy and principle. So I'm fighting evil right here for this patient. What's been ailing him for years. And honestly, if he hadn't found out about us, he would continue to live in pain the rest of his life. And it's just gotten so bad recently, he had to do something about it. Huh?
Yeah.
5 minutes left. Yeah. Sorry, 5 minutes left. I'm just talking to my anesthesiologist, Dr. Burndes. So we are fighting evil here. And this is a good versus evil story. And we're fighting evil on the reimbursement side as well, trying to get these surgeries covered by insurances consistently. We are getting coverage, don't get me wrong, but it's spotty and inconsistent. And we want consistent coverage. And people deserve consistent coverage. They deserve to have this procedure available to them and not have to be forced to have a fusion. Because a fusion many times won't fix the problem. It just makes it worse, and it's dangerous for the patient. So we're going to revolutionize the spine world with this procedure in more ways than one. We're going to revolutionize it in the curing of back and neck pain and thoracic pain. We're also going to revolutionize it on the reimbursement side and getting the insurance companies, the evil empire. We're going to win. We're part of the rebellion here, folks, and we need all the support we can get. And if you understand what I'm talking about, then you need to join the fight and stop being an observer, waiting for someone else to fight for you. It's a call to action. All right, we're just about done here at L4-5. And again, there's more bleeding. It's the red stuff. See all that blurriness right there? That's a little bit, I mean, it's so small. Don't think that that's a lot of bleeding. That's like nothing. It's literally a few drops of blood. A few drops of blood would make it turn red like that because we're so magnified. So we're not bleeding a lot. We've probably lost literally 2 cc's or 2 milliliters of blood. That's 40 drops of blood. This whole surgery, 40 drops. Literally, if you stub your toe outside, walking around barefoot on asphalt, you will bleed more, far more than this surgery, okay? And typically we lose half of a cc, which is 10 drops. But today we're losing 40 drops. So 4 times as much blood loss, but it's still nothing. All right, questions from the audience, because we're pretty much almost done here. That's 1 minute left.
No current questions.
No questions? You guys know everything? That's amazing. Come work for me. I need people who know everything, or want to know everything at least. Come work for Deuk Spine. All right, very good. So just wrapping up, this is the last of the tear, getting rid of this herniation here. All right, let's go ahead and start a video to show the viewers maybe one of the last patients that had this done. I don't know if you have one of those loaded.
I do.
But that would be nice, because we're pretty much done. I'm going to show you the incision real quick. You guys can look. Let me just zap this. Hold on. A little bit of fat, by the way, just getting in the way. But give me 1 minute here. So we're just looking at the disc herniation from the top down, from the foramen down. And like I said, I've gotten rid of it. Just want to get all of it. That looks good. All right, we're done. Laser off.
Lights on, please. Yeah.
Let me show you guys this incision. Can you see this here?
Yep.
So this is about a 1/4 inch incision. It's tiny. The whole surgery is done through that. We're going to put a little antiseptic just to make sure there was any bacteria or fungus in there, or virus or protozoans, which of course there's not, that we would kill it. Because betadine is very good at killing every microorganism, except for prions. I don't know if it works against prions. Prions are a special virus particle that's very bad. We won't talk about it. It causes scrapie in cows, sheep, mad cow disease. You might have heard about it. It's the only microorganism people don't really understand. It has a special category called prion, P-R-I-O-N. And it's like every neurosurgeon's nightmare, because if you get a patient who's demented and you biopsy the brain, literally the virus, the prion, we call it a virus, but it's not really, it won't die with autoclave. It won't die with chemicals that we have. You have to throw everything away if you do a surgery on a patient with prion. So I don't know why I'm talking about prions. I just kind of went off on a tangent, but all right, let's take a look here. This is the incision, 7 millimeters, 1/4 inch. I'm applying pressure to his muscle because we went past through it, and we took the tube out. I want to make sure there's no bleeding in the muscle, so you put pressure. If you are going to get bleeding, it's always going to be from a vein. Vein bleeding is 10 millimeters of mercury, maybe 12. It's not much, so putting a little bit of pressure on the muscle keeps the blood from extravasating while the wall of the vein seals with a platelet plug and then fibrin that your body makes. All right, type your questions up for me. I'm going to come talk to you about them in a few minutes. In the meantime, check out this patient that had the Deuk laser disc repair. This is Dr. Aru Deuk-Majan, CEO and founder of the Deuk Spine Institute. I'm here with one of my patients, and you've traveled from where to the Deuk Spine?
Idaho.
Idaho, with your lovely husband, and we've had a few conversations. She came here to have her back fixed. How long have you had back pain for?
For over 7 years.
Okay. And what kind of work did you do before you retired, if you don't mind me asking?
It was desk work.
All right. And so you had back pain for 7 years. Did you have an injury to your back, or did it just kind of gradually come on?
It just gradually came on. I actually noticed it first in 2015 when I was gardening and I couldn't be up there for 8 hours. I was into it for about 4 hours and I had to take a break. And as time progressed, my breaks got longer and longer, and the amount of work I did in the garden was less and less.
Understood. And you're retired now. So what's it like having back pain limit your ability to do stuff when you're retired?
For me, it's very frustrating. I can't do that what I want to do. So we kept seeking solutions and nothing was working. They did work for a short while, but that short while decreased over time. It was shorter and shorter. My husband does research very, very well. Through his research, he found you. We read that you can fix my back, and you did fix my back.
That's right.
And I thank you.
You're welcome. So when did you have the Deuk laser disc repair done and the Deuk plasma rhizotomy?
I had those done yesterday in the afternoon. I am sitting straighter than I have. I'm standing straighter. I'm walking normal. It's like, wow, new me.
Look at that smile right there. I hadn't seen that until just now. So,
well, it wasn't there yesterday.
Yeah, it wasn't there before surgery. And how long have you been not smiling because you've been in pain? I mean, really bad pain. How long has the really bad pain been there?
Well, the really bad pain has probably been over the last 5 years. It's something that was really tough to maintain a positive attitude and try to keep a smile on my face and keep Jeff's hopes up. I tend to be a positive person, but there were times when it does drag you down.
Of course, yeah. It's hard living with chronic pain, and especially with loved ones, they have a hard time, relating. Of course, they want to be supportive, and your husband is a very supportive man, obviously. And he's a pleasure to meet. I know he's an author as well. Yes. And so what are you going to do now that you've had the surgery? And you could see actually the Deuk laser disc repair procedure she had done yesterday. You can see right here, we went into the discs that were damaged. You had 2 annular tears. We tested your discs during the surgery, and indeed they were causing your pain. So we verified that with our discogram. And then I went ahead and used the laser to clean up the tears that were causing your pain and get rid of that source of pain for you. And here you are, you're doing fantastic. How much of your back pain from before surgery do you still have?
Oh, virtually nothing.
It's gone.
It's gone.
Cured.
My lower back, I have not been without pain in my lower back until your surgery. It's constant, it's always there. I've never been without it. I'm without it now.
So are you going to go back to gardening?
You bet I am.
All right, very good. And what other things would you like to do now that you have a new back that doesn't hurt you anymore?
You know, the biggest thing I want to do? I want to go fly a kite.
Good for you. Let's go fly a kite then.
That's right.
Well, congratulations on having faith
Oh,
and being
thank
brave
you.
and getting it done.
Oh, not a problem.
Is there anything else you want to say to your fans out there?
I highly recommend Dr. Deuk's Spine Institute, Dr. Deuk personally, to help you fix your back.
Thank you. I appreciate that. All right. Safe travels.
Phew, that wasn't too bad, was it?
It was wonderful. Dr. Deuk Machen here at the Deuk Spine Institute with one of my patients who's traveled from North Carolina because he had some herniated discs in his lower back and he was having problems with the back. What kind of problems brought you to Deuk Spine Institute?
Dr. Deuk, it was severe pain that I had never experienced before, and pain that scared me so much that I thought it was going to change the way I lived. I've got a family and I'm active, and it literally scared me to death. And as I'm talking to you right now, the hair standing up on my neck, the pain that I was suffering and where I thought I was, I didn't think there was going to be an answer.
And you were pretty much bedridden. You couldn't get out of bed. I remember you showed up here in a wheelchair because any standing was causing sciatic type pain in your leg.
Yeah, there was no doubt. And that's not an over exaggeration where I could maybe get up, like stand for 15, 20 seconds so I could get to the bathroom to go urinate, for instance. But then when I got there, I had to lay on the floor so I could rest up a little bit so I could stand with pain to even be able to try to urinate. And this went on for 2.5 weeks. It was absolutely brutal. And there was no respite. Pain that I had in the past, I could find some position where there was some respite from the pain, and there was nothing.
So your wife is a physician. Was she able to fix your back problem for you?
I wish. No, I mean, she consoled me. And in the town that we come from, we know a lot of folks. And to be absolutely honest, we just weren't getting a lot of help. And like I said, we know a lot of folks, and it was prolonged, and we were talking about pain management and all that, and that's just not for me. And like I said, I was scared to death.
The problem with pain management, unfortunately, is that it doesn't fix the issue when you have a herniated disc and back pain from a herniated disc, because you need surgery on that disc to repair it. That's what the Deuk laser disc repair did. And you can actually see here that we went into his disc with the endoscope and we were cleaning out the herniation with the laser. And the laser actually makes a huge difference. People say, oh, lasers, they're not used in spine surgery, but they are. And they're very, very powerful tools and very precise. So we were able to clean out your discs, remove the herniation. And how do you feel today?
I feel great. I mean, it's probably, I mean, I know I'm on camera right here, but I literally could not walk into the office yesterday. And I mean, you're gonna see my shorts and everything, you'll have to edit, whatever, but I'm able to walk.
That's awesome.
And I'm just, it wasn't even close. I was actually, and I don't know if you can tell from the camera that what my personality is, but I try to be very polite, and I was apologizing for profusely sweating because I hurt so bad. It's not because of the Florida heat by any means, it's because I hurt so bad. I'd never experienced pain like that. And like I said, there's no
because you're a redneck too. You know, you're not that far from Florida.
That's
you're
right.
Just up a state or two, right?
That's right. Yeah.
A couple of states. So you're feeling better today. It's been less than 24 hours since we did your surgery. You went home an hour after the surgery, back to your hotel with your lovely family who I met. And how do they feel about your progress?
They're happy that I'm happy. You know what I mean? Because they were scared too. You know, now they were putting on a strong front, but I am just telling you, I was at my wit's end. And I certainly are a lot more appreciative of people who have pain that I'm aware of, because when there's no rest from it, oh my gosh, you know what I mean? I was really at my wit's end, and you saved me. So I appreciate you very much.
You are welcome, sir. Yeah. Is there anything else you want to say to your fans out there?
Thank you. Sorry, I could have prettied you up for you a little bit better. So just had surgery yesterday.
All right.
Cut me some slack.
Excellent. And you're heading back home today, correct?
Yeah, right. Going back on the plane later this evening. The kids are going to swim a little bit down here in Melbourne. I'm just going to rest and watch TV, but then we're going to get on a plane a little bit.
Awesome.
Yeah.
All right. Well, congratulations. You had faith.
Yes.
You took the leap and you got the surgery done.
Yes, sir.
All right. Awesome.
Yep.
It's Dr. Deuk at the Deuk Spine Institute here in Florida with one of my patients who had the Deuk laser disc repair for a back injury, and it was around 6 to 8 weeks ago. And you're back for a checkup. How are you feeling today?
I feel wonderful. I feel great. I feel fantastic. I mean, this is the man. He's the man.
Well,
and I came in with a lot of pain. I couldn't believe it. And now I'm virtually pain-free. It's unbelievable.
How long did you have your back pain? How did that start?
Oh God, that happened many years ago at work, at least 20 plus years. And I had other surgeries in the past, and they really didn't help. And this last one, it just got so bad that I had to do something. So luckily, through the grace of God, I came here, and
Amen.
Yeah, and I'm A1 now.
Awesome. So you had your surgery. You've been doing therapy. Would you say the pain you had in your back before surgery is still there, or is it gone?
Oh, it's gone. It's gone. I have little twinges now, but they're muscular, and which is fine. That's going to go away over time. But my God, what a relief! I'm ready to get back out there and do all the things I used to do, man. It's kind of exciting. It's kind of fun.
Well, it's important that people understand too. When you have 20 years of chronic debilitating back pain, what happens is the muscles in your back shrivel up and atrophy because you're really not active anymore because it hurts too much. So, you know, we can fix the spine pain, but it's going to take time to rehabilitate the muscles and get them back to normal. So I'm glad we're touching on that. So what does your life look like now that we've gotten rid of your back and leg pain?
Well, yeah, I'm going to go back to what I've always done and what I've always enjoyed doing, which is my automotive hobby. And I'm really looking forward to being able to actually lift things again and getting the contorted angles that I used to get working under cars and stuff. It's just gonna be nice. Quality of life is it's
not too soon with any of that lifting engines.
All right, But all kidding aside, I have noticed over the years I developed a way to walk, almost a crab walk kind of thing, and I got used to it, and that's the way it's going to be. I don't have that now. I mean, it took a little while because it was some pain trying to get the muscles to come back. But my God, you just stick with it. If you got to get it done, stick with it, because you're going to get better. You're going to get better.
Well, yeah. Congratulations. Is there anything you want to say to wrap things up to your audience?
He's the man. Come see this guy.
All right, congratulations.
Thank you, doctor.
God bless, sir. God bless you. All right, I'm here with one of my patients who traveled from Australia to Florida to the Deuk Spine Institute for treatment. And you look happy today.
Yeah.
Yeah? Why are you so happy?
I'm happy because my back pain is gone.
Your back pain is gone?
And my leg pain is gone from
Awesome.
the disc, yeah.
From the surgery yesterday?
Surgery yesterday, yeah.
And you had the Deuk laser disc repair?
I had the Deuk laser disc repair, yeah, that's right, yeah.
So why did you come all the way to Florida from Australia for the Deuk laser disc repair?
I've been suffering from back pain and leg pain for nearly a year after an accident. So I did a lot of conservative treatment like physiotherapy, exercise physiology, but it hasn't cured my pain. the pain was chronic, and I've been suffering from a lot of issues, emotional frustrations and things, and sleepless nights. But a couple of neurosurgeons back in Australia has offered me a surgery. They both offered me a fusion, which I don't want to go for. So then I have looked into Dr. Deuk. I found Dr. Deuk, and he's doing an amazing job doing a laser technology and also doing very minimally invasive procedure. So I thought this is what I wanted, and it's a faster recovery. I could go back and work back within a couple of weeks. So that's why I traveled all the way from Australia to US.
Yeah, and we did your surgery just yesterday evening.
Yeah.
So it's around 12 hours now from the surgery, and your pain is gone. And you can see in the video here where we did the laser surgery, we got into your disc endoscopically, and we used the laser to clean the tear in the back of the disc at L5-S1 where their pain was coming from all the inflammation. And now that back pain is gone. And you didn't have to have fusion. You didn't have to go to the hospital. You didn't have to deal with narcotics, right? You said you took a couple of anti-inflammatories and a muscle relaxer yesterday.
Yeah, but I didn't have much pain about with the surgery because it's laparoscopic and minimally invasive, I believe.
Yeah, that's correct. That's correct. So there's not a lot of trauma. There's no scar tissue. There's just a little incision. And of course, we don't remove any bone or ligaments from the spine. It's all done minimally invasive and naturally. So it's a natural healing of the disc. Now, you said just a minute ago you were suffering with a lot of pain and the effects of pain on your psychological well-being. And I know what you do. You're a nurse who helps patients that have behavioral issues, like anxiety, depression, and maybe other things. But you can appreciate how devastating chronic pain can be on people and their loved ones around them.
That's true. Yeah, I completely agree. It not only disturbs you, also your family. That's what I understood. So psychologically, after a few months, I should say, you will have that frustration of chronic pain, and then your behavior start changing towards others as well. And it's not only about you, it's also about your people living around you. That's very important. Yeah.
You came here for a purpose. You got your surgery that you had hoped to do. Now you're going to go back to Australia.
Yeah.
You got a long trip ahead of you coming up. And how do you feel about your experience here at Deuk Spine overall?
Oh, it's really good. Staff is really welcoming, and it's spot on, and they receive you with a smile, and which is really great. And my father was telling, it's amazing how he never thought that in American health system people the clinicians are like this. So he was treated differently probably before while he lived in US, but it was really amazing, and your staff is really cool.
Thank you.
Say, they're welcoming. They're good.
Thank you very much.
And you are the best. I
appreciate it. It's an honor to take care of you, and it makes me feel so satisfied to see you happy and out of that pain. So congratulations.
Thank you, doctor.
You're welcome.
If you're suffering from back pain, this is a very good cutting edge technology and very advanced surgery, which Dr. Deuk has developed his own, and without minimal, no damage to the bone, no damage to other things, and easily approaching to the disc and removing it. He is very skillful in reaching there without, manipulating any of your muscles or anything. And you can see from me that I have recovered within few hours after the surgery. So I would say if you don't want a long-term complications from the surgery, this is the best surgery you can get done by Dr. Deuk here.
Congratulations once again.
Thank you, doctor.
Dr. Deuk here, and thank you for watching our live stream, our live broadcast from the Deuk Spine Institute and Surgery Center of Vieira, where we do our surgeries. We have just watched a patient who has been suffering with debilitating back pain from 2 herniated discs. One was L4-5, and you can see on the MRI scan inset that we put up there that the L4-5 disc is very black and dark because it's degenerated, and then the L5-S1 is still pretty good looking. The L5-S1 is a more recent herniation, that's why the disc isn't degenerated yet. But the L5-S1 would become looking like the L4-5 over time. If we didn't go in and fix the tear like we've done, then that gets rid of the inflammation in the L5-S1 disc. Therefore, it prevents it from degenerating. The only surgery in the world today you can do to prevent degenerative disc disease is the Deuk laser disc repair, the surgery you just watched. It's done at Deuk Spine Institute. And the reason for that is this. I'm going to show you guys what I'm talking about. We're going to take a disc out of the spine and look at it and kind of look at the back of the disc. This being the front here and this being the back here where the herniation is. So what causes degenerative disc disease is this tear in the back of the disc, and the jelly is pushed through, and because of the blood vessels in the back of the disc, it starts to create inflammation. The inflammation is redness, swelling, tenderness, pain, increased temperature because increased blood flow. And what happens is the inflammation brings your body's fighting cells, cells that fight. And their purpose is to, one thing, destroy and clean up. They're like, soldiers with machine guns or cannons, or whatever the latest weapon is, but they destroy. That's what those weapons do, destruction. And all that destruction in your disc destroys your disc. So the Deuk laser disc repair, we go in, as you saw in the video, we clean the tear and clean out the herniation in the back of the tear, and that stops the fighting. It stops the war. We are the peacekeepers with this procedure. And when you stop the inflammation, you stop the destruction of the disc, you stop the degenerative disc disease. You also stop the pain, and you allow the disc to heal naturally. Deuk laser disc repair is the only surgery in the world that does that because we pioneered it right here. I am the pioneer, and I published it years ago. So other surgeons will eventually probably start trying to copy what we do. It's fine. I want more people to have access to this treatment. It's better than anything else available. That said, we do have some questions. I think we have one question about when do we have the live programming. That's usually every Tuesday and Thursday, but not every week because I don't have surgery every week. I have times where I'm not operating. But our policy at Deuk Spine is we broadcast live all of our spine surgeries. We don't broadcast live our pain management procedures. We just broadcast live our spine surgeries. And so the spine surgery for today was the one you just watched. That's our only case that we're going to broadcast today. We do have another surgery. It's a Deuk plasma rhizotomy. It's done for thoracic pain in a patient that has basically facet joint pain in his thoracic spine. He has arthritis pain in these joints here. I'm going to go in there and use plasma to destroy the medial branch of the dorsal ramus at 3 or 4 nerves. And that will be next, but we're not broadcasting those yet. We will eventually start broadcasting those. Are there any other questions?
Not necessarily, but we do have a comment from Jane Brew on LinkedIn. And she was watching one of the testimonials from...
Hi, Jean on LinkedIn. Thanks for commenting.
Jean, yeah. And she really, just watched one of the testimonials, and she... it hit her, and she, quote, I want to go fly a kite. This part really got to me. Seeing this woman so excited about the ability to do something childlike again, to have a feeling of fun and freedom that we often take for granted in our younger years. You are doing something very special here.
Thank you very much. I appreciate the sentiment and the comments, and I feel the same way. I've told the story a few times over the years. I was drawn in life at a young age. Since I was a child, I was drawn to people suffering, and I don't know why, but I don't know where it comes from, but as long as I can remember back into the deepest part of my childhood, whenever I saw somebody in pain, it made me feel in pain. and I wanted to help them. And so as I went through life and eventually became a doctor, and eventually a neurosurgeon, I don't feel like I planned it myself. I feel like I was led here by something that I don't know what it is, by fate, God. I don't know what you want to call it, but for me it's God. And you know, when I disclosed in my neurosurgery training in medical school, when I was about to become a neurosurgeon, I disclosed my interest in helping people in pain. I was discouraged to do that by my mentor, my number one mentor at the time, with Dr. Marty Weiss, the chairman at USC in neurosurgery, also the head of the residency review committee. He identified me as the top candidate for neurosurgery that year that I applied in 96, 97. And he said, you can go anywhere you want, do anything you want in neurosurgery. And he envisioned me doing tumors, brain tumors, skull-based tumors, or blood vessel aneurysms. And I told him I wanted to help people in pain. And he said, oh no, there's no good neurosurgeon goes into pain. That's for like the bottom of the class kind of people. You don't want to do that. And I listened to him for a couple of years, and then I was drawn back to fixing people in pain. So here I am, you know, and I'm trying to get the word out. And I know there's a lot of, unfortunately, I feel like, at times I feel like it's almost too hard to do, to spread the word that people don't have to live in pain anymore. We can fix it. Because every time I tell people, a lot of them, they just say that I'm lying or don't know what I'm talking about and that we're crazy, but it's true. We do it all the time. The key is you have to know the sources of pain. And I keep telling people there are 32 causes of lower back pain. 32 distinct things. And what I do when I see a patient with lower back pain, I think about all 32 causes and I eliminate them either through the physical exam, the MRI, the X-ray, the CAT scan, the nerve test. I start, nope, not that one, nope, not that one, nope, not that one, nope, not that one. And when I'm left with, it's usually 2 or 3 or 4 or 5 different things. Those are what we treat because those are the cause of their pain. And I confirm that on the exam, I confirm it on the imaging, and that's why we're successful at fixing back pain is we don't just do shots or a spinal cord stimulator. We actually get to the source of the pain and we treat that source. And by treating the source, there's treatments for every cause, by the way. As long as you know the source, you have the treatment. But if you don't diagnose the source and you do a treatment for something else, they're not going to get better. They may get better temporarily, but it won't last. So the key is to identify the sources of back pain and to treat each one with the best treatment available in the world. Right now, when you have a herniated or bulging disc or degenerated disc causing your back pain, the best treatment in the world is the Deuk laser disc repair. Will it always be that way? Maybe not. Maybe somebody will think of something better, a better way to treat it that I haven't thought about. And there'll be a less invasive, more successful, better treatment. But right now, the Deuk laser disc repair is that treatment. Any questions? All right, I hope you enjoyed the surgery today. I'm sorry we only have one to show you, but we'll probably be back next week, hopefully with more surgery.